or sponsors. Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is Caregiver Solutions Info with Marcia Teal. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on CareGiverSolutions.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teal, as she brings information to you that may just be the caregiving solution you need.
Hi, everyone, and thank you for joining us today for Caregiver Solutions Info Show. I'm so glad that you did, whether you're listening in Southeast Florida on the radio or joining us on the website, CareGiverSolutions.info. We are live right this minute, but I happen to be on location at an Arden Courts in Largo, Florida. That's near Tampa, for all of those people not in the Florida area. And we are actually doing the show live from the Arden Courts of Largo. So I'm so excited to be here. I travel around the country to different locations, and I meet the most wonderful people that are involved in healthcare and that are involved in helping caregivers solve problems, give them great advice, give their expertise, lend a hand, whatever it takes. Because most times you will find that if you just ask, they're willing and able to help you. And that's one of the things we're going to talk about today is caregiving, how difficult it is, some of the issues that caregivers have, family caregivers that really are thrown into the situation that don't have a background in caregiving, but the situation has lent itself to all of a sudden you're the caregiver. And so it's very important to be educated, learn as much as you can about caregiving, because preparation is really the key. So just like the Boy Scouts and the Girl Scouts, we want to be prepared for any emergency, any issue that might come up. Hopefully, maybe it won't happen, but if it does, we'll be better prepared. So I'm very excited today over here in Largo that I have met a wonderful lady. Her name is Celisa Bonner. She is an LCSW, which means Licensed Clinical Social Worker. She's a dementia consultant, and she is here to share all of her expertise and experience with us today, and I'm so happy. So, Celisa, thank you so much for being here.
Thanks for having me.
Well, I know that you are a very busy person and you're in high demand, so I'm so glad that you took the time out today to be able to come on the show and help us out to talk about caregiving and support for caregivers. I know that you're a clinical coordinator, or the clinic coordinator, for the Madonna Platt Center for Alzheimer's and Memory Loss, which is located at the Morton Plant Hospital in Clearwater, which is just a hop, skip, and a jump from here. And you'll be there 14 years in January. That's amazing.
Yeah.
So let's start for a minute with that, because this is a memory loss clinic. And I know you have, you want to share with everybody what a memory disorder clinic is. And I know this one's a special one, and you can tell us about that and how it became to be. And first, what does a clinic coordinator do? What are your main functions? What's your main job there?
So a clinic coordinator is really like the first contact a family or even a patient themselves will have to try to navigate what's going on with memory loss. My phone number is kind of like a main contact number, so whenever I receive a phone call, someone just says, I need to be seen for memory loss. So I try to see what assessments maybe have already been done by maybe another neurologist in the community or primary care physician, or maybe this is just their first call and they haven't seen any doctor for years. So I try to find out specifically what their concern is, who they've seen, and then navigate the assessment for them. We really encourage them to be seen by a neurologist, because a neurologist specializes in brain health, that is an MD, and a neurologist is going to look at them, everything medically that can be affecting their changes. From head to toe, because they could have some type of infection, they could be on the wrong medication, or it could be sleep or a thyroid issue. So we really need to see what's medically going on with them, and then that neurologist will order specialized diagnostic testing, which can include, of course, a brain scan, more comprehensive blood work than just a regular primary care physician may generally order, as well as sometimes a carotid ultrasound if it might be a vascular change from the heart that's affecting the change in the brain. Even a sleep study, because sleep deprivation does affect our cognition or our memory. And also neuropsychological testing, which is the patient would see a neuropsychologist that has a psychologist that specializes in brain health, and then they would go through a battery of cognitive tests. And so it's a very comprehensive assessment. So as a clinic coordinator, I get the patient to help them navigate through the whole assessment process.
So it sounds like the memory disorder clinic is a one-stop shop to have everything done in one place so that you can coordinate all of the tests and all of the results to help the patient.
Exactly. That's what it's geared to do. And we are located, we service Pinellas and Pasco County, and we are located in Clearwater.
Okay. So that is awesome. Why don't you tell me how the clinic came to be?
So our name is Madonna Patak, Center for Alzheimer's and Memory Loss. And Madonna Patak, she actually was a resident in Pinellas County. And her husband, the caregiver, and he could tell that there was something that was going on with her. And so after he visited a neurologist and determined that she had really mixed dementia, which is components of Alzheimer's disease and vascular dementia, he felt the burden of caregiving because he didn't really know what else to do. And this was before our memory clinic actually was established. And so he was trying to navigate himself all the resources, all the assessment process in Pinellas County. And, he did a good job. But as he continued to take care of her in the home, he could see how much stress it was. And he was in his 90s when he became a caregiver for his wife, who was in her early 90s as well. And so he was a philanthropist. Will Patak was a philanthropist, and they had no children, so he was kind of thrown into caregiving by himself. And so he wanted to help establish
for Alzheimer's disease, and maybe even help the health system provide an assessment that could help the community. So as a philanthropist, he was wealthy, and he wanted to donate some funding. So he searched all over different health systems and research centers in Florida, and he decided to work with Morton Meese Foundation.
Okay, that is very interesting. Let's go to a break because I want to hear more about this, and we'll take our first commercial break.
The inability to recognize the obvious often occurs with Alzheimer's, particularly among the family members who care for them. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to us. We know. We understand. We can help. Arden Courts. Wandering is a common problem for people with Alzheimer's or related dementias. It's also a problem for family members who care for them. Keeping them safe and secure means never letting your guard down. And even though deep down you know it's time, it hurts to have to ask for help. But it could hurt them even more if you didn't. We know. We understand. We can help. Arden Courts. Feelings of depression, isolation, and frustration are common among persons living with Alzheimer's or related dementias. It's common among those who care for them, too. It takes a lot of patience and courage. It also takes knowing when you can no longer do it alone. At Arden Courts, memory care is all we do. Talk to us. We know. We understand. We can help. Don't let guilt keep you from making the right decision. Visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines.
CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
Hi, everybody. We are back, and my special guest today is Celisa Bonner. She is a licensed clinical social worker and a dementia consultant, and I'm actually here with her in Largo, Florida, at an Arden Court, and she is a social worker, and she is a clinic coordinator at the Memory Disorder Clinic, which is in Clearwater. And we've been talking about what a clinic coordinator does. So thank you, Celisa, again for being here today, because we want to let people know about memory disorder centers and clinics where they can go and get some help. And I know this was a special one in Florida, one of 16 that was part of the governor's Alzheimer's disease initiative for the state. But you also have a master's in social work from the University of South Florida and a license in clinical social work. So how many years have you been actually in the field of being a social worker and helping families?
So I've been in social work since 1989.
And when you are helping families, yeah, go ahead.
I've worked in the hospital setting, hospice setting, long-term care nursing home, and then now I'm in a specialized neuroscience institute working especially with memory disorders.
So you mentioned about people that call the Memory Disorder Center because they feel that they need to get tested, something's not quite right with their brain. So these are people that are taking that initiative and calling themselves. But do you ever have caregivers or spouses that call and say, I think something might be wrong with my husband or my wife and I don't know what to do?
Most definitely. A lot of times it is the family member that will call, whether it be an adult child, a brother or sister, or the spouse that will call. And so we'll give them the education, and what they want to do is they share that with their loved one to try to let them know what to expect, what the process is, and then they'll usually call us back to get scheduled because they don't want to overwhelm their loved one, because they want to get them in to be seen, especially when they're kind of resistant to do that.
Well, that was exactly my next question, because we find that people that may be experiencing some memory loss is evident to their family, but maybe not so much to them, and they're in denial about it, and they don't want to go and get tested, and it just gets worse. But is there ever a time where they finally give in, or do you have to do, the family, do they have to do a lot of cajoling, or how's the best way to handle that in your experience?
Well, we always say one person with a disease process is one person with a disease process. So it's according to really where they are in the disease process. sometimes it just takes another family member that they have a good relationship with that they will do anything for. And so sometimes we see where different family members will have to come along with them so that the individual or the patient will be agreeable to do the assessment. But sometimes it is hard to convince them because you're really trying to deal with a disease process or reason with a disease process if that person is not aware of their changes or their cognitive decline because of that. They've lost that awareness, and so sometimes family members actually are not able to bring them in until maybe later in the disease process. So sometimes it takes a couple of tries to actually have them come in.
Yes, and so let's say that finally a family member was able to get the person in, and all the tests that were done were conclusive that the person had Alzheimer's, let's say, for example. So a lot of caregivers have told me, they say, well, I don't want to tell my loved one he has Alzheimer's. I don't want the doctor to give him the bad news. What's your take on that? Do you think it's better to not tell them and try to deal with it as a caregiver and not tell the patient what's going on? Or do you think that it's better to tell them up front and let the chips fall where they may?
But we really do want to honor the wishes of the family, the caregiver. We do understand the importance to disclose the information for everyone present, but also the caregiver has to be the one to continue to be with them after they leave our doors. So our specialists, our neurologists, neuropsychologists are very sensitive to the needs of the caregiver, or especially for that request. So they may just use terminology where you do have some memory loss, and it seems like it's going to be kind of progressive, and so we're just here to help you through this time of your memory loss. And so sometimes they'll just use that because it's not as scary, but and maybe disclose the full diagnosis to the caregiver so that at least the caregiver knows what they're dealing with, and then we can help the caregiver plan for the future.
Right, and that's part of what the memory disorder clinic does, is help the caregiver too, right?
It seems like a majority or most of the time and effort is really spent with the caregiver. We do the assessment with the patient, and then once we have that information, we're still here for the caregiver, till the end. Seems like a lot of times caregivers will come to us to get the diagnosis, and maybe 2 or 3 years later they're still calling on us, or even more at that time, because their loved one is having a lot of changes, and now they need to know what should they do next.
Right, because as most people know, or if they don't know, Alzheimer's disease can last for many, many years. I mean, 2 to 20, with typically being about 10 to 12 years as the average.
Exactly, and that's usually after diagnosis. So we really believe that the diagnosis or the disease is, of course, there many years before it actually is evident in their functioning.
Yes, and so I think the real point here is to tell caregivers that look for these signs, that they're not crazy, because these are little telltale signs that are developing way before the diagnosis ever happens.
Exactly. A lot of times we have a lot of people calling us during the holidays or right after the holidays, because maybe they might see mom or dad once a year, or their brother or sister once a year, and they've spent that lengthy holiday with them during Thanksgiving, and they can really tell they've had changes. And so that's when our phones really start ringing, because they've seen a change from year to year, or from the previous year.
Right, people that haven't visited or spent much time for a long period of time are probably going to pick up on those signs a lot sooner.
Right.
And would you recommend then that families get together to discuss and maybe share different changes that they've seen to get a better picture of what might be happening with their loved one?
That's excellent. We always recommend families have a family meeting, whether it be individually one-on-one or FaceTime on the phone or a telephone conference call. They really need to talk about what is the plan, what type of assessment do we need to go to have to get mom checked out, who's going to take her, who's going to be there, who's going to be the one to talk to the doctor, who's going to follow up on all the recommendations. So let's start now to find out what's going on and then also work together as a plan, because it's better to do that now once you see changes instead of trying to make that decision during a crisis.
Yeah, let's talk about the crisis, because some people wait until a crisis to even try to put a plan in place, and that just doesn't help the situation at all. And matter of fact, I think it makes it worse, because then they're just grabbing at straws to try to fix it when it would be a lot better to have a plan, even if you don't have to use that plan for a long time or maybe ever, but to have that plan in place. I'm sure that in your experience over all the years you've been, doing caregiver support groups, that you've seen or witnessed or been privy to some situations where it just was a crisis. What do you think about that?
Most definitely. You really need to, it's easier to make a decision when you're not in a crisis. Like you said, you might not ever have to use that plan for 3 to 5 years, but at least you already have some security or peace of mind to know what you're going to do, and other family members know what the plan is, so whenever the time comes, if you have to use that. But it's better to be able to do your homework, do some research when you're not, being held down to the wire to make a decision within 2 hours. It's better to do your research now, check out what are the options for care, for in home, for in facilities. Where's your loved one going to live? Are they going to live in another state with another family member? Are they going to live in the same place where they lived, and with their what they're familiar with their surroundings, with their friends, their support system? So all of that needs to be addressed. Are your advance directives? Have you met with an elder law attorney to get the durable power of attorney set up, for that specific state? Or do you need to have 2 if you're going back and forth between 2 states? Do you have your living will, your healthcare surrogate? So all of that homework needs to be done before you make any kind of decisions or changes in that person's life.
So there is quite a lot to do when you're faced with Alzheimer's or some other form of dementia in your family that has to be coordinated. You have to get your team members. You have to put all these things in place. And it sounds like, it's hard, but it's going to be harder if you don't do it.
Exactly. You have to do it. You can't stick your head in the sand. You have to do it, and you'll be glad that you did it.
Yeah, it's something that we never want to do, but it's the best thing for us. So you just do it. As Nike says, just do it, and things will, flow a little bit smoother. You're certainly going to have some bumps in the road, and I always tell caregivers that if they have a plan A, you better be prepared with a plan B and C and maybe even D, because when you're dealing with dementia, it just kind of twists and turns, and it can take a twist or a turn when you least expect it, and all of a sudden your best plan is no longer viable, and now you've got to go to plan B. So this is something that caregivers, should also look at as have alternative plans. So if the one doesn't work out, what are you going to do next?
And that's what we do at the Memory Disorder Clinic. While the patient is undergoing their neuropsychological testing, which could be like a 3-hour battery of testing in one day, then the social workers will meet with a family during that time separately. So we talk to them about the hard questions. We get them to think about that. Try to get them to go ahead and let them know that they've got the homework, or they've got to talk to a family member. We ask the hard questions. What would happen? What's your plan for your loved one if something happens to you? Like if you needed to have surgery and therapy, and maybe you can't leave your loved one alone. What's that plan? So we try to get them to think. What are the about the tough questions now before they even have a diagnosis. We just want them to start thinking in that, through that process now, because it is a process. It's just going to take time to come up with that plan and to get all those family members together. But we want them to start thinking about it now before it's too late.
Right, and Alzheimer's disease, we talked about the average length of time, so sometimes people think they have a lot of time to prepare, but everybody's different, and sometimes the disease progresses a lot faster with some people than others, and the hard part is you never know how fast it's going to go and what turns it's going to take. So don't be fooled, I guess, by thinking, well, I've got plenty of time, because there are a lot of factors that influence the progression of the disease, like age and health and environmental factors and a lot of other things that sometimes we can't control. And that's the hardest part, because you can't control this disease, but you can control what you can do to be prepared for it.
Right. And we do have some caregivers that will say, well, okay, well, how many years do they have left? And we let them know, we can't decide that. We're not the one to determine that. But now is the time to start planning, because you're right. We do not know how this disease process is going to play out in that individual. It's all about their health. It's all about their good brain reserve, their education. If they have a higher education, it seems like they have a good brain reserve, and sometimes their disease process shows up later in life, because they've been able to ward off that disease, the progression of that disease for some time. So we can't really give.
Everybody's different.
Everybody's different.
Yeah. So,
and once the brain starts having a disease, it's going to continue to disease. It's not going to stop then. It's just going to continue to atrophy. And you don't know the progression of that atrophy.
Right, because it is a progressive disease. You can't stop it. I mean, there's some medications that came out on the market from the pharmaceuticals that said it slows it down, but really there's nothing out there that can stop it right now. And we can hope for a miracle, but right now it's just ongoing, and you got to go with the flow with it, and it's challenging, but there are things that caregivers can do to help them with those challenges. And one of the things is go to a memory disorder clinic and go to a support group like what you facilitate, and find out, from other professionals, and find out from other caregivers what you should know, and just get educated and be prepared. And that's probably the best thing that a caregiver can do.
Exactly, is just to educate. Stay educated, be in a support group that can give you that support, because they're going through the same thing that you're going through. They understand. They're living the same life that you're living.
Right, and they've walked down that path before, and they'll hold your hand, because I've noticed all through the years how caregivers really bond together and support each other, and it's really a nice thing to have as somebody who understands everything on a personal level that you've been through.
I hear caregivers say this is their other family, the family that really understands. Even sometimes after their loved ones have already gone, some of them will still come back to the support group for a good time, because they don't want to really leave that family, and they feel like they can help new family members. And so we encourage that, because they've been on both sides of the walk, and they can kind of guide caregivers to expect what's going to happen next. What possibly could happen next.
Yeah, and that's awesome that they feel that way, and they're there to give back. And I think it's therapeutic for them too, to be able to share and help other people through the process. And it's something that makes them feel that they're giving back in some way to help others.
Right.
So we're going to take a quick commercial break, and when we come back, I'm going to be asking Celisa some questions about what caregivers seem to have issues with the most. So we'll leave you with that, and we'll go to commercial break, and we will be right back.
Are you a senior? Do you need help in your home?
The inability to recognize the obvious often occurs with Alzheimer's, particularly among the family members who care for them. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to us. We know. We understand. We can help. Arden Courts. Wandering is a common problem for people with Alzheimer's or related dementias. It's also a problem for family members who care for them. Keeping them safe and secure means never letting your guard down. And even though deep down you know it's time, it hurts to have to ask for help. But it could hurt them even more if you didn't. We know. We understand. We can help. Arden Courts.
CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
We are back, and I'd like to take this opportunity to thank our national sponsor, Arden Courts Memory Care Communities. Arden Courts has about 50 memory care communities throughout the United States, 10 of them right here in Florida. And Arden Courts is excellent when it comes to helping not only people with the memory loss, but also supporting the family caregivers by offering lots of resources. And today, they'd like to offer you a free resource. This is a book. It's called The 36-Hour Day. It's written by Dr. Peter Rabins and Nancy Mace. It's in its 5th edition, which means that it's a great book, and it's been around a long time, and it keeps getting updated as new information comes out on caregiving and disease process of Alzheimer's and other dementia. And the book is yours just for the asking. So if you're a family caregiver and you don't own the 36-Hour Day book, I would highly recommend that you call our toll-free number and ask for it. That number is 888-478-2410. Again, 888-478-2410. Give them a call anytime. Tell them you heard about the offer on the Caregiver Solutions Info Show, and they'll be happy to get your information and get a book mailed out directly to you. So, my guest today is Celisa Bonner. We've been talking about caregiving, about difficulties that caregivers have, about what a memory disorder clinic can do for you if you have one in your area. Florida is actually blessed because we have 16 in the state of Florida and was part of our governor's Alzheimer's Disease Initiative program. I am in Largo, Florida right now with Celise Bonner, and as a dementia consultant, she has a lot of experience helping caregivers and working at the disorder clinic. So thank you for being here again. I'm so happy that you were able to join us, Celisa.
I'm glad to be here, too. Appreciate it.
Well, I have a question. Now, you have been doing support groups. You're a support group facilitator for 3 different groups, and you've been doing that for over 10 years. So you have lots of experience with listening to caregivers and advising them and helping them through the process. So my question is, what do you see as a common thread or the most common issue that's discussed or brought up at the support groups? Is there one that stands out more than others?
Driving.
Driving.
That's a big issue, is about driving. Should my loved ones still drive? When should they stop driving? How do I tell them to stop driving? How do I hold them accountable to stop driving? So that's a big issue.
Okay, so let's say I'm in your support group and I'm the wife and it's my turn to share, and I say, I don't know what to do. My husband's driving me crazy. He wants to drive, but he has dementia, and the last time that he was in the car, I thought he was going to kill us, and he doesn't know where he's going, and when I tell him to turn left, he gets mixed up and he turns right, but yet if I try to drive him, he won't let me. So what am I supposed to do?
So first of all, I would just make sure, has he been seen by a neurologist? Has he had an assessment? Has he had the neuropsychological testing so we can actually know what his ability is or what his cognitive functioning is? Based on the comprehensive assessment that we do at the memory clinic, our doctors will make recommendations. Maybe they need to go for a driving assessment, a drive-able cognitive assessment, or maybe they just need to stop driving, or maybe they might still be all right to drive, but just have the caregiver just to kind of monitor that. And if they see changes, make sure that they let the neurologist know as soon as possible. It's a very touchy subject because it's the independence. It's someone's key to independence where they can get in the car and they can go anywhere they want to. And once that's removed, then they're kind of like a burden. Some of them say they feel like they're a burden. They have to rely on someone else. Or they may go into deep depression just because they are just continuing to decline. They're stuck in their home. They're stuck in the four walls, and they can't get out. And so we really have to make sure if they don't have a caregiver and we're telling the patient to stop driving, that we set them up with an alternate transportation plan so that they can still be active as best they can in the community, and they can still, have the socialization. They can still be involved in the same activities as they were before, but we just want them to be safe as well as, people in the community to be safe. So it's a very tough pill to swallow. It is hard for the physicians to inform a patient that they need to stop driving, but we know it's very important. It's very important. Really, the question is, what I've heard is not when should you stop driving, or maybe if you should stop driving, but when. When should you stop driving? And so that's why we always do comprehensive assessments every year just to evaluate that progression of the disease process to guide the patient and the family through that.
Well, again, from the voice of a caregiver, I've hidden the keys so he can't find them, but that just makes him madder. And he spends all day hunting throughout the house, driving me crazy, repeating himself all the time because he's focused on those keys. And so one time he did find the keys, and he, again, got in the car, and I was so scared. So my son told me I should just unplug some of the wires in the car. So I thought, if I have to do that, I'll do it. But like you said, it kind of prohibits me from going, too, if the car is not actually working. So I guess there's alternate, maybe, solutions, but he won't listen to the doctor when the doctor said don't drive. So I'm just going to have to keep trying to find things that distract him and take up on some of your suggestions. And that was the voice of a caregiver.
And so sometimes it's just you have to kind of put your foot down. You can't really reason with a disease process. And it is, sometimes you do have that battle. But you want to remain safe and you want him to be safe. And a lot of times we have some caregivers, they say they put the note or a letter from the doctor on the refrigerator or in the front seat of the car. So when they're leaving, and the wife gets in the driving seat, says, okay, I'm driving because this is what this doctor says. And a lot of times we have to include therapeutic fibbing, which means, we're going to lose our house, all of our belongings, all of our insurance, our car, if you drive and you injure someone. And actually that can happen. where you can be sued because it's in the medical record that your spouse should, stop driving, and then you have to be in court for a couple of years to kind of defend that. So it's very serious. It's not to be taken lightly, and sometimes you just have to be the caregiver that has to stick to the guns to make sure that he's going to follow through in this process. And it is a battle. Sometimes it's a battle every day or every time you have to get in the car. But as the disease progresses, usually that battle is going to subside, but sometimes it does take time. But it is hard. We just encourage caregivers just to try to do the best that they can.
Right, and I'm glad to hear what you said about the therapeutic step, but in the case that we mentioned, it is true. I actually heard of a caregiver who allowed her husband to continue to drive, and he had an accident, and he got sued big time because, like you said, it was in his medical record that he had been diagnosed and that the doctor told him not to drive, and it's very serious when this happens. So like you said, you've just got to stick to your guns and do whatever you can to prevent that from happening. Very, very serious. So what other issues are big with family caregivers? Since driving was the most talked about one and the one that they all want to talk about, what would be the second one?
Oh, wandering. I'm really concerned. I really probably shouldn't leave my loved one at home, but I still want to come to the support groups. So sometimes I really don't know what he's doing while I'm gone, or when I get home, will he be there? So wandering. And that's a scary thing.
Right. It's
because
scary.
There's no really predictor. Yeah.
Right. And caregivers will say, well, he's never wandered off before. I leave him home in front of the TV, and he's never wandered off before. And my reply to that is, until he does. He's never done it before, but there's always the first time, and you don't know when that first time is going to be, that something's going to prompt him to get up and walk out of the house.
Clinicians have done some research for a while, try to see what the predictors of wandering are in the Alzheimer's disease process, and they can't come up with anything consistent. So, like you said, they're not a wanderer until they do it the first time, but we just educate caregivers just about that part of, or that behavior, part of the disease process. Everybody doesn't, but some people do. And whenever they start, that means that's how the disease is going to dictate its care. If you can't really lock them in the house, some people do, but sometimes they're kind of little Houdinis and they're going to get out somehow, whether it be through the garage or through a window, and that lets you know that they're trying to go home, or they're trying to do something. They don't really know what they're trying to do, but they need possibly a different level of care.
Okay, so that's a good indicator there of maybe this is time to look at the environment, the situation, and maybe we need to, have a plan in place because of this.
Exactly.
Okay, so that's really good. I know that is a big one. We're going to take a quick commercial break. When we come back, I want to ask Felisa to share some personal experience that she's had with Alzheimer's in her family. So stay tuned. Don't go away. We want to hear this. So we'll be right back in just a moment.
The inability to recognize the obvious often occurs with Alzheimer's, particularly among the family members who care for them. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to us. We know. We understand. We can help. Arden Courts. Feelings of depression, isolation, and frustration are common among persons living with Alzheimer's or related dementias. It's common among those who care for them, too. It takes a lot of patience and courage. It also takes knowing when you can no longer do it alone. At Arden Courts, memory care is all we do. Talk to us. We know. We understand. We can help. Don't let guilt keep you from making the right decision. Visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines. Somewhere at the corner of bewildered and confused is a lost mother, a father, a sibling, a grandparent. Wandering is a common symptom of Alzheimer's or related dementias and can often make those who care for a loved one feel just as lost. If you're looking for a place that's safe and secure, look to Arden Courts. Memory care is all we do. We know. We understand. We can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing
He's a
opportunity
dementia
guidelines.
care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
We are back, and my guest today is Celisa Bonner, and she is a wonderful person with lots of experience as a clinic coordinator for a memory disorder center and a support group facilitator for over 10 years. So, Celisa, I know you said it's okay if we talk about this, but with all the experience you have with helping other families dealing with aspects of dementia and Alzheimer's, unfortunately, you had some personal experience too. Could you share that with us?
Sure. My mother was diagnosed with early onset Alzheimer's disease at the age of 59. And then she died 10 years later at the age of 69, and that was like in 2012. And so, as I said earlier, that's when you're diagnosed. So the disease process really is happening before. Of course, you can't really pinpoint when it's before. But my mom is the one that really started noticing changes herself. My father and I, and my brother, we really never noticed anything at all because she was a very smart person, loved to read. She was very active. She was like the administrative secretary to a large hospital, to the president of a large hospital. So she's very organized. Just had part of a lot of events, volunteer clubs, and so forth. So we really didn't see anything, but she's the one that she noticed herself. And so I was working as the director of social services at a nursing home at that time when she came to me and said, I really want to go to a doctor and see maybe what's going on with me. And so I tried to ask her specifically, what are you talking about? She goes, well, I think there's something going on with my brain. I think my brain's changing. And so we took her through an assessment, like a memory disorder clinic, through an assessment that also had some research. And so my first witness of her struggling is when she had to read the paperwork sitting there in the lobby of the doctor's office, and she started asking me, what is the definition of a specific word that she should have known? And so, and that was my clue to me. She couldn't understand or retain information that she was reading, and she didn't know what it meant. And so it seems like she started having more word-finding difficulty that affected like the frontal portion of the brain. And so she eventually lost her ability to speak. And some people might think, oh, well, that's a stroke, but it's just the way that the brain atrophied in her specific disease process. I mean, she was still able to, work on a computer and write cards and cook and do things like that, but she just started losing her language, and then it started affecting the way that she functioned. You could just kind of see the progressive decline, being more unkempt and just some different behaviors, and then she started wandering as well, and that was a big reason. My dad always wanted to take care of her at home, but the disease dictated the care she needed when she started to be wandering. And so that's when you have to kind of step aside and not be the daughter any longer, but be the social worker and say it's time to start making some plans for her care.
So how hard was that, being a social worker and knowing what you know, but then relating it to your mom and trying to be the daughter, did you find it difficult to play both of those roles?
Well, it was, because you're trying to educate your family about, this is what we need to do, this is what we need to do, and then they would let you know, well, I'm the caregiver. I will make those decisions, but you just know that maybe some type of care that they might be missing out on, or some benefit that they might be missing out on, just because the primary caregiver didn't want to follow that route. So I would try to, it's hard. It's just a balance. When you're more emotionally involved with someone, trying to make those decisions are harder, because I'm like, well, I wish I could, do what I tell my caregivers. It's easier to say, do this, and you're not really doing it yourself. But it lets you see how hard it is being a caregiver, even though maybe I wasn't the primary caregiver because I was the daughter. It just lets you have that more of an experience of what the caregivers go through.
Right, so you can relate, I'm sure. But your mom was fairly young when she was actually diagnosed. She was only 59, and they would call that early onset Alzheimer's. So did Alzheimer's run in your family with your mother's parents?
Actually, it didn't. We have done some kind of genograms or some history, and there's no one in our family that's ever had dementia. But my mother's father died when he was 52, and she was like in second grade, so of a heart attack. So we're not for sure if he would have lived longer, would we have seen a disease process, a dementing process, in his life. We already know he had heart disease because he had a heart attack. So, but no, there's no other family member that we could trace back that even had a dementing process. And she is one of 5 children, and none of her siblings have any type of dementia at all, or any type of neurological disease. So it's kind of really odd, because it seems like, if someone in your family has cancer, you'll have that risk factor. That doesn't mean you're going to have cancer, but if someone has dementia, you have like a 4% increased risk factor. That doesn't mean you're going to have the type of dementia, so it's really hard. You don't know where it starts from. We don't see of any other family member in our history that's had that. So that's why it's kind of interesting. It has to start from somewhere, but you don't know where.
Right, and that's what makes this disease so insidious, because you don't know who, when, and how it's going to happen. What was the hardest thing for you as a daughter, watching your mom decline with Alzheimer's disease?
What was the hardest? Just her not being able to speak, not being able to communicate. I would go see her in a nursing home, and there would be sweet patients in wheelchairs that saying, "Oh, hey, sweetie," If I would take my daughter to go visit my mother, "Oh, your daughter's so cute," but my mother had lost her language, so she couldn't communicate. I could ask her a question, and she couldn't really speak, and to the point where she didn't even know how to spell words, or words. She just lost language, period. Words didn't have any meaning anymore. So just the lack of communication. So that's where you have to make sure your body language, you realize as a caregiver, your body language speaks volumes to someone with dementia. They're going to know if you're frustrated. They're going to know if you're upset just by your tone of voice, by your body language. And so therefore you have to learn to communicate, trying to love them in a way just with, soft touches and just being soft in your whole demeanor. If they can't communicate, then you just hold their hand, just give them a kiss, and, just spend that quiet time with them, because if there's no communication available, that's all you can do.
Right, and just be there. I mean, just the fact that you're there and relating, because even though she couldn't speak, there's a lot of times when the caregivers say, I know that they still know who I am, even though they can't tell me. I know that they know that I'm their person. I know that deep down inside they know that I belong to them. And that gives them that comfort or that peace, knowing that just being there with them and relating without even really, having that validation from the patient it's comforting to them just to know that they're there for them. And it's almost like they have this little ESP or telepathy going on, just being together, especially for couples that have been together maybe 50 or 60 years.
Right. I think it's just a different relationship. It might just be a persona of peace. It's just a persona of peace where instead of different caregivers, hired caregivers that are coming in, they have a job, they're focused on something, whereas the spouse or a family member walks in, it's just a peace. It's not, chaotic. They're not there just for a specific task. They're there just to be with that person.
That's right. That's right. Well, our time is up, but before we leave, just any last words of wisdom to give to caregivers?
You have to take care of yourself. You're so consumed about your loved one and what's going on with them or what's their plan, but what is your plan? What's your plan to take care of yourself on a daily basis? You can't neglect yourself because you've got to be there to the end providing care for them, whether they're in a facility or not or at home. You've got to take care of them. You've got to take care of yourself so you can be there for them. That's
right. Put your own oxygen mask on first, as the airlines say.
Exactly.
Well, thank you, Celisa Bonner, for being with us today. It was so nice to have you and share this information with our caregivers. I really appreciate you being here for everyone and for everything that you do.
Thank you for this opportunity.
You're welcome. And thank you to all who joined in today to Caregiver Solutions Info Show. Be with us same time next week for another wonderful show to learn and to get education, support, and advice from the experts. So until then, don't forget, give somebody a hug because they need it and so do you. We'll see you next time.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teal. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on CareGiverSolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers.